Hello, everyone. Welcome back to another episode of 2-Minute Emergency. I am your host, Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you important topics to help keep you safe, healthy, and out of the emergency department. So, as you have probably already heard, this is National Women's History Month. Some people just say National Women's Month. I'll take it either way because I love it. This was actually established in, I believe it was 1987. So it's been going on for a few years, and I am excited to bring you topics this month that are more focused on women. So my topic today is hypothyroidism. A lot of people have heard about it. Not everyone knows exactly what it is. So let's start out with what is the thyroid. So the thyroid is a gland right here in your neck. It's about 15 to 20 grams, and it controls so very much. So the main thing you can think about it as the metabolic control of the body. So how does this work? Well, in the brain, an area called the pituitary has a substance called thyroid stimulating hormone. And that sends a message to the hypothalamus, another part of the brain, which sends that when that message is received, it says, time for me to release this hormone. So it sends a releasing hormone, which then sends a message to the thyroid. The thyroid then produces two main hormones. For shortness sake, we'll call them T3 and T4. And those are the pathways which help to control this whole system. Now, as those thyroid hormones are elevated, they send a message back to the pituitary gland and tell it, we need a little more, we don't need so much. And so it's a cycle. And that's how the whole system works. So when I said that the thyroid controls the metabolic system, it does for many parts of the body. So we're talking about the brain, the heart, the liver, and the muscles. So when all of this comes into play, it helps to keep us on a steady balance. So what does hypothyroidism have to do with women? Well, it affects women disproportionately. And 1 out of every 8 women has a thyroid issue of some sort in their lifetime. Now, this doesn't mean they have thyroid disease. It can be a very temporary condition, but it can affect us, especially in cases where we have increased stress, illness. There are some medications which can cause this problem. So it's a lot of times when our thyroid can just be thrown out of balance. And that's one of the importances of knowing the symptoms that can be involved in that and knowing where to get help. So I haven't mentioned the emergency department yet, and that's for a reason. So at this point, we know that simple things can start out with you just feeling a little tired, a little sluggish. Your mind is just not as sharp as it usually is, and you're just feeling blah and tired. Hi, Gertrude. Thank you so much for joining us. And Karen, thank you for joining us today. So when this starts to happen, usually you feel, I'm just under the weather. Something's going on. But if this continues, that's when things need to be investigated, typically by your primary care physician. Now, how does the emergency come into effect? Well, there's something called Metabolic coma, and that is when your thyroid hormones become so low that you need emergency intervention. So it's called Metabolic coma for a reason. That's when, as I said, you become so fatigued, you actually fall into a coma. And when that happens, everything that regulates just starts to decrease. So beside the decrease in mental status, you get a decrease in heart rate, which is called bradycardia. You get a decrease, actually, the one thing that does increase is your blood pressure actually increases. You get a decrease in your fatigue, as I said. Other things that you can get is you can get weight gain. You can get just overall tired and fatigued. You can get dry and puffy skin. You actually get constipation because I said everything in the body starts to slow down. your reflexes are even decreased. So this is not something that's that common in young women. The typical age for going into myxedema coma is approximately 60 years old. Now, it can happen in younger women with pre-existing condition of hypothyroidism when you're not compliant on your medication. That's why your primary care physician, and probably everywhere that you've ever heard, says, take your medications. They're prescribed to you for a reason. Don't stop taking your medications because you feel good. You feel good because your medications are working. So when these cases happen, patient comes into the emergency department, it's important that we are able to identify that right away, because even with treatment, if someone is in a myxedema coma, they still have anywhere from a 25 to a 60% chance of dying. So if you know someone who has hypothyroidism and you start to see changes in their behavior, as I said, the biggest thing to see is start to become more sluggish, more fatigued. You need to make sure that they either see their primary care physician and or come to the emergency department, because it's quite common as your primary care physician is doing your blood work, they'll add on those thyroid hormone levels so they can tweak your medications as needed. And that's on a regular basis. So if you notice these changes, seek attention immediately. Now, I must mention, there's also a hereditary component to this. So if you have a mother, grandmother that has hypothyroidism, it's quite likely that you will too. So for those people who don't tend to follow a primary care physician at all, it's time. Make sure you do those preventative measures, as I said, to keep you healthy, safe, and out of the emergency department. So the most common type of hypothyroidism in the US is something called Hashimoto's hypothyroidism. And that is part of an autoimmune disease where your body actually senses your thyroid as being something foreign, and it actually attacks your thyroid gland and slowly breaks it down. So as it's breaking it down, your body's thinking, okay, I can't produce this hormone. And less is produced. And so you're more likely to have this bad outcome. So I hope you found this helpful. And I hope that you will continue to watch my 2-minute emergencies. If you miss any of them, you can go to my YouTube under Dr. Leslie Sharp and find out more information on my previous topics. So once again, I am Dr. Leslie, board-certified emergency physician, international speaker, best-selling author, and professional photographer. And I bring you these 2-minute emergencies to help keep you safe, healthy, and out of the emergency department. Until next time, be blessed and stay well. Take care.